All right, benefit brokers, employers, anyone who needs to responsibly recommend these GLP-1 medications or pay for these medications, listen up. November 8th, mark it down, is the day we all had to make a decision about whether to act or wait. That day, November 8th. Whenever you're seeing this, it's that day. Eli Lilly's GLP-1 drug was approved by the FDA for weight management at the monthly price of $1,059, which might be lower than we expected. I thought it was gonna be around $1,300. A lot of people maybe upward of $1,600, but came at that price. They're swinging for the fences here. More adoption, long-term use, multiple indications, and it will be covered by health plans. So, here is the current GLP-1 for weight loss situation we are in today. Ozempic and Mounjaro are approved for type 2 diabetes. Wegovy, which is Ozempic, is approved for long-term weight management. That's Novo's drug. Zepbound, Mounjaro's drug, was approved on November 8th for long-term weight management. That's Lilly's drug. The American Medical Association classifies obesity as a disease, so it can be treated with a medication. But, and this is a big, big but, CMS, Center for Medicare and Medicaid Services, classifies obesity as a risk factor for other illnesses or diseases. Now, my opinion, and many others, is that this will not stand for long, as Lilly and Novo Nordisk are already completing successful studies with these drugs in cardiovascular improvements, kidney disease, liver disease, and more. Flipping the obesity thought upside down, it's not a complication from other diseases, it's actually causing them, right? It's been exposed. So far, if you are not covering Wegovy, add Zepbound now for weight management on your employee benefit plans. It is because you can hide behind the CMS classification. Again, for now. Zepbound had even better results in their weight loss trials than Wegovy did. CMS is now feeling the heat. They are definitely feeling the heat right now to add this under the disease classification, which opens it up for treatment with a medication. If a plan does not cover FDA-approved medications for a disease or an illness, then expect lawsuits to start coming, especially with how widespread this is. Upwards of 60 to 70% of your employees might technically and medically qualify for this medication. We're already seeing lawsuits against companies not covering these meds. And it's very expensive when employees start leaving to go somewhere else to get them. So Zepbound and Wegovy were approved under the same language with diet and exercise modifications. But the medical system is not structured to enforce that at all. Or enforce it well, I guess. Like, in a way that will protect your prescription spend and put the patient at the best possible situation for long-term success without being dependent on a $1,000 a month plus medication. Well, get what I did there? I mean, right now, you qualify for the med, you get the med, and then you go home and take the med. That's it. You start losing weight, that's a success. The doc qualifies that as a win. Well, employers, the real payers, can enforce lifestyle in their plan structure. That's what the FDA said they should do. All in compliance with those FDA recommendations. We'll get more into that. Now, I explain our current situation like this to many conversations I've had over the last few months. We are on a beach that we know is susceptible to tsunamis. Some have even hit this year, but we have avoided any big damage. Sure, it's a risk, but you or I haven't felt the dollar pain yet, right? Experts have been telling us that a large tsunami is likely coming soon. But we're not moving. We're not moving yet. The sun is out, all seems fine. Experts say that if we see these two things happen, these two dominoes will fall, it may be too late. We all should prepare now. Those two things are if Lilly gets approved and if CMS flips to a disease. Well, guess what? Lilly just got approved. The first domino. That was the underwater earthquake several miles out. It happened. It's done, and there are now events that are going to trigger because of it. Those that prepare now will be protected. Those that ignore this will panic in the future. Domino 2 will be when CMS flips to a disease. When that happens, water has already reached the shoreline. It will come slowly and then faster and faster and faster. That water is the medication usage and impending claims costs on your plan that year. It's gonna get ugly. It will start coming fast and it will cause great damage. north of $1,000 a month and say 60% of your employees qualify for it for long-term use, as the pharma drugs say, you can see the cost risk. And if you don't address lifestyle, you remain at risk, as employees never fix the underlying cause and the roller coaster through weight gain and weight regain starts. So what is your action? If you want to look at a structure to achieve cost containment and put your employees or your patients in the best situation for long-term health and dollar savings, please reach out ASAP. There are ways to approve these medications on your benefit plan that will enforce lifestyle modification engagement alongside medication use at no additional cost if you structure it the right way. That is where everyone can win. You lower the usage, you lower the utilization, and you get better outcomes. In your plan design, with your third-party administrator, everything works in the plan design. There's nothing new to invent at all. These medications are brand new. You have to adapt. Your budget is now protected, and more importantly, your employees are protected. I mean, we also bring your employees a diverse set of coaches from all different geographies and backgrounds, as well as 5 different languages. This is essential to providing them the highest quality of support, no matter where in the organization they work. So, to sum things up, this medication is the biggest decision you will see in terms of plan design for the next several decades. Watch those 2 dominoes fall. We got one that just fell today. Where's number 2? Get in now for 2024 to stay ahead of this, or start planning ASAP for 2025. Even then, that's a dangerous game of kick the can. So we hope to speak soon. This is such an important decision for everyone, and there are structures in place that you can protect your budget and protect your employees for the best possible outcome. You just got to get a little creative, inventing nothing new, but it all lives in your plan design as per FDA recommendations. So let's talk, everyone. Thank you.